HMO, EPO, PPO, HDHP. What do all these letters mean? Each grouping represents a different medical plan type that we will explore today. Let's jump in. HMO, or Health Maintenance Organization, and EPO, or Exclusive Provider Organization, are very similar, so let's look at them together. In general, HMOs and EPOs do not have a deductible. When you see a provider, you will usually pay a fee called a copay, and the plan pays the remainder of the cost. HMOs and EPOs have smaller provider networks than other plan types, meaning you have fewer choices on where you can receive care. Care outside of the provider networks is not covered, except for true emergencies. There are two key differences between HMOs and EPOs. With HMOs, you generally have to select a primary care physician, or PCP, and get a referral if you need to see a specialist. This is not the case with most EPO plans. An HMO or EPO might be right for you if you value lower out-of-pocket costs in exchange for in-network only coverage. Next up, let's look at a PPO or Preferred Provider Organization. Like most plans, with a PPO, your per-paycheck cost will vary depending on the specific plan you elect. For some services, like doctor's visits and prescriptions, you'll owe a set fee, generally referred to as a copay. The plan will pay the rest. This can make your medical costs more predictable. For other services, you'll have to meet your deductible before your plan contributes. Once the deductible is met, you'll pay a percentage of the total cost, called coinsurance. PPOs offer a larger provider network and also the flexibility of using in- and out-of-network providers. Out-of-network care is usually covered at a lower percentage, so you will owe more out of pocket. You do not need to select a PCP or get a specialist referral. A PPO may be right for you if you value the flexibility to visit any doctor or hospital you want, you use your insurance a lot, or travel frequently within the United States. Last but not least, let's look at an HDHP, or High Deductible Health Plan. With an HDHP, your deductible is usually much higher. You're responsible for all out-of-pocket costs, including prescription drugs, until this higher deductible is met. These costs will vary based on how much you use your insurance. In exchange for a higher deductible, however, your per-paycheck cost is generally much lower. Like a PPO, once your deductible is met, your plan will cover a percentage of the total cost, up to your out-of-pocket maximum. An HDHP is the only plan that allows you to set aside pre-tax dollars in a health savings account, HSA. You can use this money for qualified healthcare expenses, such as paying towards your deductible and additional eligible healthcare costs. The ability to pair an HSA with a low per-paycheck cost can help you plan for your healthcare expenses. Most HDHP networks offer similar flexibility to a PPO, with a larger provider network in and out of network coverage, and no PCP selection or specialist referral required. An HDHP might be right for you if you're relatively healthy, usually only see doctors for preventative care, or want more control over your healthcare expenses. One last important thing to note: all plan types cover eligible in-network preventative care at 100%. And true emergencies are also covered, regardless of network restrictions. To better understand your current plan, call the Member Services number on the back of your medical ID card, sign in to your member portal, or download your medical carrier's mobile app. Thank you for going back to Benefits Basics with us.